Hello, can you hear me okay? Is the mic for you or for the... pour les deux? Okay. Okay, so... Oh yeah, now I can hear me. Can you hear me okay? In the back? Or not really? Okay. It's not very practical to use the mic. So I will just sit here. That will be easier. So is it okay like that? Can you hear me? Just on the back? Sorry? Yeah, yeah. Okay. But that's... I don't know if you did it, but that's very annoying to hear yourself on the mic while you speak. So anyhow, I will do my best. Yeah, it's very nice to meet you. And so I will introduce myself, and then we'll start talking about just like climate change. And I assume you've been exposed to some lectures and courses, seminars about what climate change is about, where it's coming from, and everything. I assume you heard about it. So today I will focus on two dimensions that you probably didn't hear too much about it, which is how climate change is a global health issue and also environmental justice issue. So just to contextualize a little bit where, just like who I am and what I'm doing. So I'm a professor at University of California in San Diego at the Scripps Institution of Oceanography, which is a big institute focusing on environmental sciences and climate sciences. And right there I lead the human health or epidemiological group. And as part of this effort, we do a lot of research about the links between climate change and human health. Sorry, I'm a little bit sick today. And also try to design and understand how we can adapt to climate change and what type of policies can make a big difference. And among these policies, we spend a lot of time designing and evaluating early warning systems. So today we'll talk about early warning systems that you probably have been exposed to in your life in many, many occasions. But in parallel, I'm also like equivalent of just like a research director or professor here in France, where I have a team, a lab in Rennes, in Brittany. That's where I live. And focusing on this kind of intersection between climate, ecosystems, and human health more generally. And we have kind of a vibrant research team. So I'm sharing my time between California and Brittany. That's kind of where I'm in. But by background, I'm coming from environmental sciences, applied math, and then I will switch to public health and epidemiology. So that's just to give you a little bit of background, just to contextualize a little bit why I will talk about all of these different things. Okay, so I don't know how you usually do, but feel free to ask any questions or interrupt me also. So the idea is that I will be speaking for more or less an hour, just to give you this kind of big overview, and then we'll have an exchange. I don't know, how is it supposed to structure? Do they have like specific questions that I keep for the end? Or?
Maybe we'll ask the question whenever they want, but mostly at the end.
Okay, so whatever works for you, I will adapt. So I guess that's about it. So let's. Okay, so I have like three specific sections that I would like to talk about today. So first, I would just talk about give you a perspective about how we can define climate, weather, climate, and climate change, and how it can be linked to population health, global health, human health. And then we're going to talk about one specific case here. We're going to talk about air pollution. I will give you, just because I assume most of you didn't have any background in medicine or any just like public health. So just explain a little bit what is air pollution, why is it harmful, and then I will explain what can we do about it, the type of intervention and early warning systems specifically, and how we can implement them and evaluate their effectiveness. That will be an opportunity to talk about the different type of techniques and identification strategy that could be employed. And Alexandre told me that some of you have an econometrics background, so you will probably recognize the type of identification strategy that I will be talking about. And then at the end, I will also talk about wildfires and wildfire and smoke specifically in the context of California. And I think this is a good example to explain how climate change is going to exacerbate some issues. And this is a very not a complex, but indirect story about how climate change is going to exacerbate the frequency, intensity of wildfires in California. So we'll tell you the story to explain why we see more and more wildfires in California and where is that coming from and what are the connections with climate change. So you will see this is an interesting, and then we're going to talk about what we know about the human health impact of wildfire and smoke, and I will talk about that. So that's kind of the program. It's just a snapshot to illustrate how we can connect the links between climate change and human health. And across the presentation, I will also give you a framework about how we can think in terms of just like disproportional impacts and analyze climate change as an environmental justice issue. Okay, sounds good. So let's start by the easy part. So you probably know that, but so there is like just like the distinction between weather and climate. That's something you're familiar with, right? Bless you. And so basically it's very easy to distinguish. Bless you again. So the idea is really that you have a weather is just going to be an observation on a given day in a given location. For example, in Paris there will be a temperature today, so that's what we talk about when you talk about weather. And climate, a very simple way of defining climate is really statistics of weather. So we typically focus on 20, 25, 30 years, and we'll have a distribution of weather observations that we can describe statistically. So we can describe a distribution of weather observations such as temperature, precipitation by just like the mean of the specific distribution. It can be the kind of the standard error, it can be the extremes, etc. So climate is really just like the statistics of weather observation, and this is really how what we talk about when we talk about climate. And when we talk about climate change, it's as easy as just a change in this distribution of weather observations. So we talk about climate change when we observe a change in the mean, a change in variability, so that or change in the extremes. So this is what we mean by climate change. This is as easy as it gets to define it. Okay, so this is really how we are going to operationalize the definition of climate. I just a question for you, because the question for you only at the beginning, because that's I know you were not exposed to the rest, but I know you've been exposed to that. So I don't know if you talked a little bit about the history of climate and the fact that this is not the first climate change that this planet is experiencing. But if you look at this figure, this is just like a kind of retrospective, kind of time series on the log scale. That's very important for the temperature anomalies. So, and you can see that what we see towards the end, I don't know if you will be able to see it here, that's here, this is what we're observing. So this is like one climate change among many, not the most important one, but still, this climate change is very special for at least 3 reasons that you probably know. Can you name them? Like 3 reasons for which this specific climate change is very different from the climate change that we've been, or that took place on this planet. Mm-hmm.
It comes from anthropic
activities. Yeah, that's absolutely. This is like very specific to anthropogenic activities. That's true. What else? One important information from this figure is really that this is a log scale on an x-axis. That will help to guess what will be the second component that makes this climate change very special.
It's starting really fast now.
It's extremely fast, because the change in temperature anomalies that we've been observing in the last few decades, is the rate of change is something that usually takes like hundreds of thousands of years before in other just like changes that took place in the past. This is happening in a few decades, so that's extremely fast. And the third component, which is a little bit harder to guess if we're not exposed to it, it's also because this is also like not only happening very fast, but also it's against like the natural trend that we have been towards more like a decrease in temperature. So this is a weird climate change for these 3 reasons. One thing that I like saying is also that if we were able to modify the planet so quickly, we can also do the opposite. And there are so many reasons to believe that we can reverse the curve, and also try to think about what we can do right now, because whatever we do right now in terms of mitigation strategies, this is not change going to be observed before like 6, 7 decades from now. Okay, we have a public. So that's just like some context. And but now we'd like to talk about how we can think about the connections between climate change as defined and human health, public health. Okay, so I would like to introduce you to this concept that I assume you just are not aware of, you're not exposed to, the concept of social determinants of health. This is extremely important in public health to understand how, just like and why, like not all population have the same probability of developing a disease, and why we see inequalities in life expectancy, why we see inequalities in, I don't like, injuries, accidents, neonatal mortality, and everything. So a formal definition is really about all of the conditions and the multi-level conditions, and I will explain in the next slide why this is important to think in a multi-level way, in which people are born, grow, live, work, and age are going to influence this distribution of health endpoints, okay? Mental health, physical health, etc. And this is also a way to analyze like health inequalities, because we have health inequality, we have health heterogeneities that will constitute health inequities if these like these disparities or these kind of patterns are avoidable and unfair. So it's in public health. This is also very important to think about what can we do to reduce the gap between different groups, and try to analyze what we can do structurally to analyze that. So this is really what the social determinant of health is about, just to try to analyze systematically why we see heterogeneity over space or over time. This is really how we think about it. A very simplified way to think about this kind of multiple version of social determinant of health is just to think about this kind of multiple determinants. And one example could be just just like asthma or smoking. Smoking is probably easier. Just when we think about what is going to influence the probability for an individual to smoke. So you can think about the individual characteristics. That could, for example, be your health literacy, or just like your knowledge about what smoking is about, or you just like your preference and everything. A lot of individual determinants, okay? This is usually what is targeted when you have communication campaigns. They try to shift to try to influence your level of health literacy, but that's not enough. If it was enough, nobody would be smoking today. And still, in France, it's about like maybe 15–70% of smokers. So it's not enough. You go to the next level, like you need to think about what is going to influence your probability of smoking besides your individual knowledge and your health literacy. Is going to be what's happening in your family. If you grow up in a family in which everybody was smoking, that will have an influence. If your friends are smoking, that will have an influence. Then you go to the next level. If you live in a neighborhood in which it's very easy and to access to tobacco, it will be easier to smoke. And then if you live in a city or in a country or in a state in which there are no regulation about smoking, it's very, just like there was no tax, so it's very cheap. You can smoke everywhere and everything, that will be easier to smoke. But if you have like some taxes, if you like the density of tobacco retailers is kind of regulated and everything, that will influence the probability for somebody to smoke. So this is really what we mean by this concept of social determinant of health, the fact that we need to think structurally, and just focusing on the individual determinant is not going to be enough. Okay, so that's just like in few minutes, just like the foundations of public health. This is really how we think about just like try to address health inequalities in public health. So now, this is how we can think. This is a very simplified framework about how we can think about the connections between climate change and population health, human health, okay, public health. So first, the first mechanism through which climate change as a context is going to influence population health is by exacerbating existing issues. If we take extreme heat, for example, heat waves, so this is a topic by itself to discuss about how we define heat waves, but let's not get into that. But without anthropogenic climate change, we will still have heat waves, right? There will still be some extreme temperature events all the time. It will happen. But in the context of climate change, we just see more frequent, more intense, and longer heat events that are taking place. This is just like one mechanism. This is the easiest one. And we see that everywhere. You probably, I don't know where you're from, probably from a lot of different places, but you probably noticed that you have just like the temperatures that are reached every summer are just like getting like hotter and hotter. The duration of the heat event that you're exposed to or your family is exposed to is getting longer and longer. This is as a result of climate change. So that's the first mechanism. So climate change is exacerbating existing issues. The second mechanism, which is also very important, is to kind of lead to unprecedented phenomena or issues. Do you have an example about how climate change is going to bring new issues that counterfactually, in absence of anthropogenic climate change, these things will not have taken place? So do you have an example from France or from where you are, just about a mechanism through which climate change is going to lead to some unprecedented issues that could affect population health? There is an obvious example, specifically in France, but in many, many places, especially in the US. But I'm curious if you can think about a specific example from where you're from. Mm-hmm. No, it's okay. You can go ahead, and then I can ask you.
I think I mean in some regions, like also Switzerland, that there I think there's been now mosquitoes that were not there before.
Yeah.
They can get there because it's
Mhm.
getting warmer.
And what
Like
type
it's
of mosquitoes, or why do we have to worry about mosquitoes in relation to human health?
diseases.
Yeah, they are vectors. Yeah, so they are vector-borne diseases that can transmit viruses, specifically dengue, which is a specific type of virus that is transmitted by different type of mosquitoes. But yeah, that's one good example. What about you? That was the same. Okay. Another example?
Heat islands on densely populated areas?
I'm thinking this is so what has been said is heat islands in urban settings. So that is actually, I think it's more about, so first of all, just some definition. I use this opportunity to define the concepts, but a urban heat island is really like a macro phenomenon. This is like in Paris, in a region of Paris, the city of Paris is going to be systematically hotter than, for example, the 77, like, what is it, Seine-et-Marne? I'm not even sure. 77, Seine-et-Marne? Yeah, okay. Like this department on the east, it's very rural. That's why I'm using it. So that is a urban heat island effect. This is like very macro. Then within Paris, you can see a difference up to like 7, 8, 9 degrees Celsius because of what we call micro heat island, and that will be driven by the landscape, by the density of green spaces, impervious surfaces, and everything. And that is a problem. But to me, this problem will happen even without climate change, because there will be a heat wave, which just will be not as much exacerbated. So to me, this is more the first mechanism than the second. But we can, like staying on a extreme heat topic, what will be a mechanism through which climate change is going to lead to unprecedented types of extreme heat events? Mm-hmm.
Another example would be in the mountains as well. There's I'm not sure what the English word is, but generally the soil is frozen, and as it gets warmer, consistently warmer, not just a single time permafrost, then there's like catastrophes that happen.
Yeah, in a slow way. It's true that there are some issues, especially in relation to specific infectious diseases, in relation to the permafrost. But it's less kind of tricky to just like, there are examples that are less tricky and way more problematic right now and for everybody that can happen. This example can be, we have that in California, we have that in Europe, in East Asia, this is a big issue. It's what we call the change in the flavors of extreme heat, because in the context of climate change, there is also more moisture in the atmosphere, so we'll have more humidity and more humid heat waves. And that's a big issue, because humid heat waves are problematic for at least 3 reasons. Because first, like when there is a lot of humidity in the air, your thermoregulation process, like your physiological process to cool down, is going to be altered. It's not going to be as effective as it is when it's dry. Second, when there is a lot of humidity, the temperature is going to stay high at night. So the thing is that you just don't have a break. So people that already live with chronic conditions also are just going to have just a continuous kind of stress on their body, and that's a big problem. And a third problem, which is more about the policy side of things, is that when we think about extreme heat right now, 100% of the policies have actions during the day. And if we start to have more and more extreme heat events that are impacting people during the night, we just don't know how to handle that. So that is an example about unprecedentedness in the context of climate change. Okay? And finally, a third mechanism through which we can think about climate change as a context is an opportunity, because you know the distinction between adaptation and mitigation. It's really like adaptation is a working group number 2 from the IPCC, and mitigation is a working group number 3. So mitigation is really any action that aims at reducing emissions or concentrations of greenhouse gases. So when you think about that, you can think about different types of sectors, such as transportation, like food systems, etc. And when you think about what it will take to reduce emissions from this specific sector, most of the time it will be associated with a lot of health co-benefits right now. 2 examples. If you want to reduce emissions from the transportation sector in Paris, okay, you will do many types of interventions. We're going to talk about some of them. But you're going to reduce emissions from lack of CO2 or other types of greenhouse gases. But by doing that, you will also reduce a lot of air pollutants. And that will have a lot of co-benefits right now. You don't have to wait to see the benefit in 6 or 7 decades from now. You will have benefits on population health right now. Another example could be from food systems. If you try to reduce emission from, I don't know, like the agricultural industry, from like meat consumption, red meat consumption, that will have a lot of substantial benefits in terms of a reduction of some types of greenhouse gases like methane, CH4. But at the end of the day, it's also very promising to reduce a lot of chronic diseases like colorectal cancer and cardiovascular diseases are highly associated and caused by like consumption of a lot of red meat. So this is what we mean when we talk about health co-benefits associated with mitigation policies. Okay? So that's really like the simplified way to think about how climate change as a context is going to influence population health. And with this framework you can, and if you have any counterexample, I'm very happy to hear it, but it should include all of the situations that we can think about. So that's really what climate change is about. It's just a context that will influence population health through these three mechanisms. Okay? So now we are all on the same page. Okay? So of course, we can talk about different types of topics. We can talk about extreme heat. There is so much to do about extreme heat. We can talk about malaria, about dengue, about other types of vector-borne diseases. We can talk about drought and precipitation anomalies. But today I decided to talk about air pollution because this is like one of the biggest issues in Paris. So I wanted to talk about that. And just because we don't have time to dig into everything, so I'm just going to show you a little bit just like how we study these things and the interdisciplinarity of it, because we're going to talk about toxicology, we're going to talk about like physiopathology, we're going to talk about chemistry, we're going to talk about policy and everything. So just to show you how fun it can be to work in this field. Okay. No? Okay. I heard something. It was outside? Mm-hmm. Okay. So, okay, but before getting to air pollution, this is to me extremely important. When we think about climate change, and specifically climate change as a human health issue, this is an environmental justice problem. And it's extremely important to think about how we address the problem, how we prioritize different types of actions, and what we can actually do. So I don't know if you had any introduction to environmental justice, specifically distributive environmental justice. I don't know. Did you? Or no? That's the first time you hear about this concept of environmental justice or environmental racism? No? You heard about it? Okay. So this is how we can kind of think conceptually about why climate change, especially in relation to human health, is an environmental justice problem. So these 5 dimensions. The first one that I'm not going to spend too much time on, but because you probably heard a lot of things about it, is really this kind of differential, or this discrepancy between contribution to climate change in the past decades and where impacts are located right now. And of course, you have this pattern globally. Countries that emitted the least in the past few decades, so contributed the least to anthropogenic climate change, are the countries in which most of the extreme weather events are taking place right now attributable to climate change. So that's the first component of environmental justice. But these patterns also they take place between countries, but even within a country, within a city. If we analyze in Paris, the emissions of greenhouse gas and where the micro-heat islands, for example, are located, it will be perfectly inversely correlated. So this type of inequality in terms of contribution versus impact happens at different scales. And that's very important to think about. There are many studies, mostly in North America, showing this big discrepancy. We are conducting a study right now in France to show that. So this is, and this is the signal is very consistent with what we saw in other countries. The second component will be differential exposure, differential susceptibility, and differential adaptive capacity. And at the end, I will talk about differential evidence, which is also something that is more important, also important, but not discussed a lot. So to illustrate these 3 mechanisms, differential exposure, susceptibility, and adaptive capacity, which usually has a triple jeopardy in environmental justice, I will just take one example about extreme heat in San Diego. That's actually because we conducted so many studies in San Diego. So differential exposure, this is San Diego, and here this is a satellite image or product called LST, land surface temperature. So this is just it captures at the surface the estimated temperature on a given day. So this is one shot. This is on the same day, at the same time of the day. You can see that you have some areas on the east that are going to be systematically hotter than areas on a coastal zone. Okay. See? So, and that is going to be driven by different factors, but mostly by the landscape. So areas that will have a lot of impervious surfaces, a lot of parkings, a lot of roads and everything are just going to be hotter as compared to areas with a lot of parks, with a lot of greenness and everything. So that is a very big contributor, and that's the main, like the first component. The reason for which the impacts of extreme heat on human health are so disproportionate, so differential, is first because of this differential exposure. Low SES communities will systematically live in areas with a higher density of microwave islands, and that can be explained very logically by so many mechanisms. Okay, so that's the first reason, the first mechanism through which, or like climate change or extreme heat is going to have disproportionate impacts. Okay, but on top of that, like in addition to the, because it's not mutually exclusive, we can also think about what we call differential susceptibility. So when we think about, this is, again, this is San Diego, but this is like just like organized by zip codes. And here, this is for the same type of extreme heat event, we can see that the number of people being hospitalized like in relation to heat waves is varying a lot. And you can see, for example, this is for 100 heat wave days. So it's basically varying like up to each time there is a heat wave in a given zip code. A zip code is like a big neighborhood, basically. So each time there is a heat wave day, there will be on average 1 hospital admission in some zip codes. That's a lot when you think about it. And you have other zip codes in which there is like up, like that will be 1 hospital admission every 10 heat waves or something like that. So there is a big discrepancy in the burden attributable to heat wave, and that is explained by the preconditions. People that are going to be impacted by extreme heat are people that live with chronic conditions like diabetes, some cardiovascular health issues, or asthma, COPD, etc. And because the spatial distribution of people living with pre-existing condition is not random, the fact that some communities accumulate like a higher prevalence of diabetes, for example, this is just not random. This is due to other structural determinants, including occupation, including nutrition, including like structural racism, including access to healthcare, etc., etc. And that is why when we observe the spatial distribution of heat-related health impact, you will see a lot of heterogeneity, spatially speaking, and that is perfectly correlated with the prevalence of comorbidities. Okay, so that's the second mechanism. So the reason for which we have this disproportionate impact when there is a heat wave is first one, because there is differential exposure. So even if there is the same atmospheric temperature, some communities are just going to be exposed to 6, 7, 8 degrees more just because of the landscape. On top of that, we can also think about the housing, because there is like the outdoor temperature, but where you live indoor is going to make a big difference. And of course, some communities, some individuals are going to live in very old buildings that can actually just like have like even higher discrepancy with other neighborhoods, other buildings, etc. It can be like 10, 15 degrees of difference just because of where you live. So that's big, like 15 degrees brings you from like 25 to 40 degrees. This is a matter of death and life. So that's a big issue. But on top of that, and this is usually the same community, there is this differential susceptibility, okay? And on top of that, it's also important to think about what can we do about it. So that will be the third component of this triple environmental justice jeopardy, which is about differential adaptive capacity. So when we understand that extreme heat is a problem, and that's a big problem, and when we want to do something about it, we have a lot of actions. But once we implement these actions, we just need to make sure that access to these resources is going to be proportional and also going to be accessible to everybody, especially people that need it the most. This is just an example about cooling centers. I don't know if you're familiar with cooling center because it's not implemented everywhere. But this is basically a library, typically, that has air conditioning that will be open during heat wave days, and people, especially vulnerable people, are supposed to go there and rest and just at least have access to air conditioning for a few hours, just to reduce the potential impacts that could be linked to extreme heat. I don't know if where you're from you have this type of interventions. It's starting in France, but this is something that is extremely well established in the US. But the problem is where you implement this cooling center makes a big difference. And here on the map, I don't know what you can see, but I think you have it on your laptop, but you have all of the dots are going to be cooling centers. And what we did, we characterize the population that is visiting this cooling center. And when the dot is going to be dark, it means that the population that is typically visiting, taking advantage of this cooling center are going to be highly vulnerable to extreme heat, which is what we're looking for. But you also have all of the green dots, which will be cooling centers that are visited or supposed to be visited by people that are absolutely not vulnerable to extreme heat, people that don't have any preconditions. Sorry? As areas in which the cooling center are visited or used by not vulnerable individuals. So people that don't have any preconditions, don't have any occupational situation that puts them at risk and everything. Which means that this is another issue because there are so many cooling centers that are absolutely missing the point because they are just targeting people that are not needing it or not going to use it. So that's another component of environmental justice that we call differential adaptive capacity. It's typically a library. Usually it's set up in a library or in a public or community center or something like that. In France as well, they put it in a bibliothèque and everything, or les mairies, something like that.
Can I ask you something?
Sure.
Not really related, but this seems like a kind of an adaptive kind of policy.
Is it raining? No.
And I'm curious, do you have any opinion on whether adaptive policies have any like contradictory effect with preemptive policies? Whether like we're like deviating pounds into like putting a patch on things when we should be kind of focusing on.
Do you have an example in mind or just in general? That's a big question.
It is a big question. No, I just have it on my mind because actually one of my classmates did a podcast on that. And it was an interesting topic for me because I have never thought about whether kind of quick patch policies could actually have a negative impact on long-term measures.
You can have policies with unintended consequences. And on extreme heat, actually yesterday we had there was a seminar focusing in which there was one of the focus to think about that. And there are a lot of things that you don't want to miss. For example, if you invest a lot of money on implementing this cooling center in the wrong neighborhoods, this is kind of just like not ideal because the money and the investment you put in this cooling center is less investment in the neighborhoods that actually going to need it the most. You also have some mal or misadjustment or misadaptation. For example, when you don't consider all of the conditions that make some individuals to be outside or to be in a risky situation. Typically, it will be farmers and other workers. You can't just say, tomorrow is going to be a hot day, just don't work, if this is your source of income. So you need to just kind of be a little bit nuanced and be innovative in a type of policy and adaptation strategy that you need to think about, because otherwise that could be a problem. There are many examples about misadaptation or maladaptation.
Just a quick question about the word susceptibility. Can this be used also interchangeably with vulnerability, or is this a different concept?
So it depends on the fields, but here some people are going to describe vulnerability by these three components. So vulnerability is driven by differential exposure, differential susceptibility, and differential adaptive capacity. Some people are going to use interchangeably susceptibility and vulnerability. It really depends. But vulnerability can be the big umbrella. And susceptibility, another more formal way of defining it, is really if you expose two groups. For example, you have this class, there are like two groups, and are going to expose you to exactly the same heat conditions or anything. And if the response, for example, the proportion of people that are going to have like negative symptoms is different, you will be differentially susceptible. This is what it means. It's when you standardize on the exposure, and you will have differential response. And it's not mutually exclusive. In reality, this is actually like all of them. In San Diego, as I showed you, there is differential exposure, there is differential susceptibility, and differential adaptive capacity. So this is the three are happening at the same time. Okay? I won't cover what I was going to cover. That's okay. So another component, just to wrap up this section about climate change as an environmental justice issue, is also about differential evidence. And here I just took differential epidemiological evidence just as a just to keep up on this example. Yeah. So it's very, very important to conduct localized or local studies to understand like how extreme heat can be a public health issue. What is happening in Paris is not going to be informative for any other cities in France. It's so different. What is happening in San Diego has nothing to do with happening in the Northern California. We need localized study. This is absolutely not transportable, like evidence about heat and any type of health issue. So, of course, we need this evidence to understand what type of heat conditions are dangerous, what are the symptoms that are impacting and everything. And here in this study, and this is just like a big review to show how just few studies have been conducted in low and middle income countries. And what you can see, this is only in, like, you can see in sub-Saharan Africa, that just like more or less 10, 12 studies that have been conducted by the time of this publication, which is nothing. And what I was writing in this paper when we published it is to say that in the city of Phoenix, in Arizona, in the US, there were way more studies about heat and health than all Africa in the last 4 decades. So that is a huge, huge discrepancy in the type of evidence that we have access to. Now, of course, that can be explained, but there is so much work to do on that. And without this evidence, we can't even start understanding what's going on and where we can start doing things. So this is also, I wanted to add this component that is not usually described as an environmental justice component, but I think this is an important one in the context of climate and health. So that was really what I wanted to talk about in relation to just climate change, human health, and why this is an environmental justice issue. Okay, so now just this is now you know. Okay, so now just as a specific case study, just so we can go a little bit deeper in one topic, I want you to talk about air pollution. So, and then I will talk about wildfire if I have time. And just first of all, just like I just put one slide for the context. So what is air pollution, outdoor air pollution? Because you typically distinguish indoor and outdoor air pollution, but what is air pollution? That will be like a very, very simple definition, will be a mixture of gases, and particulate matter, aerosols. Do you know what an aerosol is? So just a small part, like a small dust, basically. They are everywhere. There are many, many, many right now. And they are outside. And what would you say, like what would you see the main contribution of particulate matter in Paris, for example, to you? What would be the main source of emission of PM, particulate matter? These very, very small aerosols. Mm-hmm. Sorry? Yeah, cars. What else? Sorry? Yeah. Yeah, that's why actually there are like a few studies in the metro in Paris that when they use their brakes, it emits a lot of PM and particulate matter. So so there are different types of gases in like right now in the atmosphere, so many, but only a few are regulated. And they're regulated because of their health impacts. And you heard about this, the regulated air pollutants. So the typical air pollutants that are being regulated that we're going to talk about are going to include two types of PM, particulate matter, according to their size, and then a few gases. The gases that are regulated include nitrogen dioxide, NO2, which is a very, very strong marker of traffic and vehicle exhaustion, like traffic emissions, tropospheric ozone, like which is, what is, do you know a little bit about ozone? Is it something you talked about in other courses? Not really. I just don't know. No. So, so ozone, it's O3. And you know, you have stratospheric ozone, which is quite useful for us to protect us from a lot of sun radiation. But there is a tropospheric ozone that we're exposed to. So what is it? We call that a secondary gas because it's not going to be emitted directly. This is going to come from a transformation, a chemical transformation reaction. So for that, you need a few ingredients. First, you need precursors. One of the main precursors for like ozone generation is like NOx, and just like what is being emitted by traffic, for example. But it's not enough. You need precursors. And if you have precursors in a context of hot temperature, a lot of sunlight, and not too much humidity, that will create ozone. And ozone is typically just like high during the summer. You have the ozone peaks during the summer days because you need a lot of sunlight and hot temperature for ozone to be generated. So that's ozone. This is another regulated gas. You probably heard about that, at least through ozone peak, depending on where you're from. But I don't know. That's everywhere. There is an ozone problem. So NO2, ozone, SO2, which is mostly like specific to industrial activities. And then the two types of PM. There is also carbon monoxide that is regulated in some location. Okay. But PM, we have two types of PM that are regulated, and you probably heard about that, PM10 and PM2.5. So what does it mean? PM2.5, for example. PM2.5 is any aerosol that will be smaller than 2.5 micrometer. So that's very, very, very small. You can see the picture. This is just like compared to a human hair. So it's a big question for you. Why did we decide collectively to regulate this specific size of particulate matter? Why is it PM2.5 and PM10 instead of PM12.4 and PM3.85, for example? Do you know? It's not a random. Mm-hmm. What do we mean by interact? Yeah, this is, yeah, exactly. This is according to how deep they can go. So PM10, 10 micrometer, this is the size that the aerosol needs, that is enough to get into the lungs. And 2.5 micrometer, this is the size that is needed to get into the alveolar. Do you know what the alveolar are? This is like where you have the exchange between the oxygen and the bloodstream. So PM2.5 is defined like that because this is the size that aerosol need to get into your lung, to go through them and get into the alveolar, then they get into the circulation system and go everywhere, into your brain and everything. So that is why we talk about PM2.5. This is the reason, okay? So this is, of course, because you can imagine if you inhale PM2.5 goes into your lung, it gets everywhere, into your, just like into your bladder, into your kidneys, into your brain and everything. It leads to a lot of issues. And overall, a lot can be said about these numbers, but overall this is an order of magnitude. We estimate like every year 7 million people die prematurely because of air pollution. This is a huge driver of the burden of disease globally. And of course this burden is not random, it's concentrated in some areas. But this is just to say this is a huge contributor to the global burden of disease. So many people are dying prematurely because of air pollution, and mostly PM2.5. Okay? Mm-hmm.
How do you know someone died out of air pollution?
No, that's what we do in epidemiology. So we don't do that individual by individual because for extreme heat, you have okay, what happens when somebody dies? So somebody dies at home, at a hospital, and then there will be the coroner or a physician that will just like use what we call the ICD, so International Classification of Disease. So there's so many classifications that are harmonized over the globe. And then when somebody dies, for example, if I die from a stroke, there is a specific ICD code for stroke, and this is what the coroner, the physician, are going to indicate. There is a specific ICD code for heat-related illnesses that the coroner or the physician are going to use when it's super obvious. When you find somebody dead in a hike, doing a heat wave in a Grand Canyon, that would be like, the code is 992. That would be this ICD code. When like an old individual, old lady is found at her home and their body is still very, very hot, obvious, etc. But most of the time this is not going to be obvious, and that could be just another ICD code. But the primary cause of death, usually it's going to be like a cardiovascular cause, and then we have to use different types of epidemiological and statistical models to try to do this type of what we call causal inference, to infer that the specific increase in mortality for whatever cause is actually linked to air pollution. Said differently, it means that if air pollution was not present, if we were able to reduce air pollution, this is by how much we would reduce the number of deaths. So that is what we do in epidemiology. This is what we do, and we spend a lot of time doing that, causal inference, and this is what we do. So that's, but we do all of that, and at the end of the day, we estimate that globally, millions and millions of people are dying prematurely because of air pollution, okay? Mostly PM2.5. So this is why we need to do something about it. So just one slide about the physiological mechanism. So if we focus on PM2.5, okay? So as I said, PM2.5 are going to be very, very small particles, very, very small aerosols. They're going to get into your lungs and get into the circulation system. So at least 3 mechanisms through which being exposed to PM2.5 is going to be harmful for your body, toxicologically. This is a simplification, but this is the 3 main ways which it will be harmful. First, inflammation. So inflammation can lead to a lot of complications. If you have asthma and if you're exposed to a lot of air pollution, it will lead to inflammation that can exacerbate and lead to a lot of asthma crisis or exacerbation that will lead to a hospitalization or even worse. Okay? Inflammation is the first mechanism. The second mechanism is going to be oxidative stress, which is basically just like the acceleration of the aging of a cell. That could be quite detrimental and very quickly. And finally, another mechanism that I think is useful to understand how it can be indirect is through the alteration of the immune system. In the lungs, what we have to protect us is, like among many things, but we have macrophages. This is just like a kind of a cell, like immune cell that is supposed to take care of all of the kind of bacteria, viruses that get into the lungs. And they're very useful. They're this is what protects us from being sick every time we're exposed to a virus. However, we showed that when we expose to a high level of PM2.5, specifically from a specific source of emission, the activity of macrophages is going to reduce, which means that the effectiveness of our immune system is going to be attenuated when exposed to a lot of air pollution. That's another mechanism through which air pollution is actually very dangerous because it weakens our immune system. Okay? So this is just like to give you like a general knowledge about why air pollution is dangerous. But that will be the 3 mechanisms that you can think about. And later, I will, if I have time, I will explain why there is more and more evidence showing how the same quantity, the same concentration of PM2.5, when it's coming from wildfire, this is way more dangerous than when it's coming from traffic. So now we know that, and there are many reasons that we can think about that, which also highlights why we need to move away from thinking about air pollution and aerosols just according to the size. We need to think about the composition as well, because the size is not the most kind of interesting or relevant metric to actually characterize to which extent air pollution is going to be dangerous. The composition, the chemical composition, chemical speciation is going to be extremely important, and wildfire is a perfect example. So if you have time, I will explain like all of this recent evidence that emerged in the last 2 or 3 years actually, and why it matters. But that's really where the start, like the kind of what we're doing and what we're focusing on right now in this field. We're trying to understand like what would be an alternative metric to capture pollution besides the size. So that's, we're moving away from thinking about PM2.5 as total mass as just like a big group of pollution, which is not sufficient to capture what's going on. No, ozone is a gas, so it's different. So yeah, I'm just going. Yeah, and ozone is mostly an irritant. So when you're exposed to ozone, this is like the same type of symptoms that I have right now, but for different reasons. Just like you have a lot of like a very sore throat, and it's very uncomfortable, and you can actually have your nose bleeding and everything, and that could be quite tricky. So, okay. So here, this is just, and that will be important to contextualize some of the results I will present later. So when you think about, we want to estimate the impact of air pollution on a given health issue, mortality or so, we estimate what we call a dose response. So we try to estimate what is a kind of statistical relationship between a given concentration of air pollution, say PM2.5, and a given probability of dying or a given health outcome, whatever. So usually this is a shape of the relationship. It's typically log linear. Okay, this is typically the shape of the relationship between, on a y-axis, the risk of dying for a specific cause, and an x-axis concentration of PM2.5 or ozone or any other pollutant. This is typically the shape of the relationship. And what is very important is that there is no safe level. Any level of exposure to air pollution is associated with a given level of risk. Of course, the higher the exposure, the higher the risk will be, but there is no safe level. Even when you're exposed to very, very small exposure to air pollution, we will see effect. Mm-hmm.
Why is there, like, one of the curves is first going down?
Just like noise, basically. And there is a lot of statistical uncertainty because there are very few observations at these very, very low days. But when we do this type of studies in Canada or in Scandinavia where air pollution are very low, we see that even at like 1 microgram of exposure, we see an increase. It's, of course, it's better to be exposed to 1 than 5, etc. But the point is that any level is dangerous, and that's very important. So that's the first kind of component. And when we talk about smog, you probably heard this term like smog days and everything. This is everything but a scientific term. Smog days is just when we want to characterize days with a lot of air pollution. But this is as vague as it gets. It doesn't mean anything. This is just like days with very, very high level of air pollution. It's not very, very specific. So now let's talk about what we can do. This is a simplified typology about all of the type of actions and regulations and policies that we can think about to address air pollution. You probably know some of them, or most of them, I guess. But you can see that you have the kind of national and international level intervention, for example, to ban lead in a gasoline, for example. That is a way to reduce like a specific type of contaminant in air pollution. You have individual level intervention. For example, you can wear a mask. So FFP2 masks, the ones that we're wearing during COVID, are extremely useful for PM2.5. Actually, they've been designed for that. The reason for which they're very useful is because they filter this size of particles. They don't do anything about gas, but are very useful for this type of particles. And the reason for which it was very useful for SARS-CoV-2, like COVID-19, is because COVID-19, or the SARS-CoV-2, the virus, was circulating through aerosols. The way we were contaminating each other, it was through the aerosols. The virus was just like set on these very, very small particles and going from people to people. So having a mask was a way to stop these particles that were kind of transporting the virus, SARS-CoV-2. So that's to believe the individual interventions. And then you have the community and city level intervention. This is what I will focus on. And here you can have different types of intervention, nature-based solution, traffic control measures, and also air pollution early warning system. This is what I'm going to talk about, and low emission zones. There is a big low emission zone in Paris, and I will talk about it in a minute. This is like the two types of intervention that we can think about. Early warning system that will be very acute, very short term when there is a peak, and a low emission zone that is really like more structural, more everyday, to ban some specific vehicles that are emitting a lot of pollution to get into the city. This is like typically how a low emission zone is working. So what I'm going to do right now is to explain what early warning system, like air pollution warning system, are doing, how they work, and I will show you an evaluation. And also to be a little bit critical about how this type of intervention are even designed. And that's why the slide I just showed you about the dose response is very important, to be critical about how this type of intervention are thought about. But before that, there are like standards, air quality standards. Like there are a lot of, in Europe, there are a list of standards, and there is also the WHO that makes specific recommendation about level of air pollution that each jurisdiction is supposed to reach, to target. And you can see here that, for example, if you focus on PM2.5, if you look at the new level since 2021, like annually, the annual average of PM2.5 is supposed to stay under 5. This is like a very wishful thinking because most jurisdictions in the world are way above that annually. But you can see that for short term, so daily concentration of PM2.5, this limit is 15. Okay? So that is just what the WHO recommends. There is no, they can't enforce anything, but this is a recommendation. Then in each country, in Europe, this is like done at the European level, but in the US EPA is actually regulating this pollutant with, like, for example, for the daily, it's 35 microgram per meter cube for PM2.5. And that is going to be very useful to actually trigger a warning system. So what is happening when a specific jurisdiction decides that this threshold is what we are targeting, as soon as the air pollution level are going to reach this specific threshold, they will activate a lot of actions that we're going to talk about. This is really the idea of a warning system, okay? So you have a threshold that is defined locally, and as soon as this is forecasted or reached, a lot of actions are going to be implemented, and we're going to talk about that. So that works, the same works for so many types of warning systems, but that works for air pollution as well. And you see that you have regular, like, guidelines for all of the pollutants we talked about. So how does it work? So this is like implemented mostly like in most places in the world. And you've probably been exposed to this type of early warning system. I don't know, again, I don't know where you're from, but it's literally everywhere. And This is, for example, LA. So this is a smoke day, so a day with a lot of air pollution in which air quality alert was actually active. And you can see you have a lot of messaging, a lot of actions that are taking place. One way to summarize these actions is like, this is a simplified kind of schematic. But when there is alert, there will be a lot of communication and interventions that are going to reach, target individual action change. For example, to stay indoor, to not engage in physical activity, to like take some preventive medication. If you have asthma, there are some medications that are going to prevent some specific exacerbated symptoms to take place. So that will be the type of recommended action at the individual level that will happen. And then you have community level actions. For example, you're going to close schools just to reduce exposure of the kids, or you're going to close specific industries to reduce additional emissions. You're going to reduce the speed limit and things like that. So that will be what is happening when there is air quality alert. Another thing that is happening in Paris when there is air quality, this is like transportation is free. When there is air quality peak, like RATP is going to allow everybody to get into the metro or the bus for free. This is just, the goal of doing this is just to like ensure or motivate people to not take their car and just to take the public transportation. You probably were in November, so we'll see. If you stay this year in Paris, you will have a few days like that in which the metro will be free. This is good news, but it also means that there is a lot of air pollution when this is happening. So this is typically happening in Paris. Okay, does it make sense? So, but just this is like in a nutshell how this air quality, and they are what they want, like the goal of this policy is on one hand to reduce emissions of air pollution, to reduce the concentration of air pollution, to reduce the burden, and second to try to reduce the susceptibility, so like the probability of people to have like negative impacts. This is why we do that. At the end of the day, this is why we regulate PM 2.5 and all of these pollutants, because we want to reduce the public health burden. So all of these actions are aiming at doing that. So this leads us to this specific case study in Toronto, Canada. So this is one of the oldest air quality alerts that has been in place since 2000. And one, I think, very legit question we had was, does it work? So said differently, in a world in which in Toronto, we actually do all of these actions when there is air quality alert, a lot of specific action, closing schools, just like a lot of communication campaigns and everything. Is it different from a counterfactual world in which nothing will happen? This is like what is a question, the causal inference question of interest, okay? So we wanted to evaluate if this air quality alert actually had an influence, had an effect on health, on air pollution and health effect. And you will see. So the way it works, instead of being specific to one pollutant like PM 2.5, ozone, NO2, they work with what they call the air quality index. This is a combination of multiple pollutants. So it includes NO2, PM 2.5, and ozone. And the way it works is as soon as the air quality index reaches 50, they're going to activate this air quality warning system. Okay? As soon as Environment Canada is going to forecast like a level of air pollution exceeding the air quality index of 50 up, they're going to start activating all of these actions, closing schools, speed limits, recommendation to reduce outdoor activities, etc., etc., etc. Okay? So that's how it works. So now I will show you just intuitively how we approach that. So I don't know, have you, some of you, if you had like you did some econ training, did you hear about instrumental variable estimation and regression discontinuity? Okay, so that's what we did. So that's, remember, that the relationship between air pollution, PM 2.5 for example, and most of the health outcome is log linear, okay? So basically, there is no evidence biologically, toxicologically, that at 50, when like there is air quality index of 50, something is happening. So we can actually capitalize on this specific eligibility criteria as an instrument, as an instrumental variable, to assess if there is a discontinuity above and below, just slightly above and slightly below this specific this specific threshold, and see if there is a discontinuity. So, because in a world in which this air pollution, like this air warning system, would not be set up, we would expect the days that are slightly above air quality index of 50 and slightly below, like days at 51 and 49, for example, to be very, very, very similar. But in a world in which there is something happening, like like driven by this kind of criteria of 50, days slightly above at 51, something is going to happen, and days at 49, nothing is going to happen. That's the idea. Okay, it's more stochastic because I make a lot of forecast errors. So at the end of the day, we need to take that into consideration, but this is a simplification. But that's the idea, okay? So this is really what we capitalize on. This is like a localized randomization. We say, okay, just like there is this specific arbitrary criteria that decided that days above 50 would receive something and days below would not receive anything. So we're just going to compare days slightly above and days slightly below. So if the policy here in a figure, you can see on a y-axis that will be the number of hospitalization, and on the x-axis air quality index, if the air quality warning system would not make a difference, this is what we should see. We should see just like a linear or log linear increase. Okay, but if there is a difference, we are expected to see this discontinuity. Okay. So this is a hypothesis, this is what we're going to test, and this is exactly what we did. And this is just to give you an idea about the identification strategy of doing it. So, and this is what we found. So this is here, you can see a lot of different health issues. So you can see, for example, you have mortality because of cardiovascular diseases, mortality because of respiratory diseases, different types of hospital admissions and emergency department visits. And here in red, you have the eligible days, so days slightly above 50, in which there is something going on, like a policy is taking place. And in blue, you have the non-comparable, non-eligible days, so days that are slightly below 50, days in which nothing is happening. So overall, we don't see a lot of differences, except maybe for asthma, where we see that the rate of asthma is lower on eligible days, which suggests that this policy makes a difference for asthmatics, a little bit. But more importantly, it doesn't make a difference for all of the other outcomes, which is very disappointing, showing that this policy that has been in place since 2000 doesn't make a huge difference. So it's like comparing a world in which we do a lot of things when there is a smoke day compared to a world in which we would not do anything at all. Mm-hmm. Yeah, and actually, yeah. In terms of random variability, this is a huge sample, so this is extremely statistically precise. So yeah, it's not showed out here, but it's what's happening. Okay, so that is disappointing because it just basically means that it doesn't work. But this is very important to evaluate when a policy doesn't work. I would argue that it's even more important to show that a policy doesn't work than it actually works. Both are important, but if I had to choose, showing that the policy is not effective and that we need to change is more important. So I guess we can discuss about that. But that's really what I wanted to show you about that. But one thing that I wanted to also highlight is even if it was effective, another problem is that this is the only thing that Toronto and many jurisdictions are doing about air pollution. And that used to be the case, it's changing now. And if we think about air pollution as extreme episode days, like this used to be the case everywhere, it means that even if this policy was super effective, it will just be super effective only a few days a year, only days above 50. And if you look at this figure on the right, you have on the top the dose-response relationship between, on a y-axis, the risk of dying for whatever cause, and the x-axis is going to be the air quality index, okay? And here you can see on a kind of bottom side, the downside of the figure, just the distribution of days according to the air quality index value. And you can see that most days are actually going to be below this criteria, right? Because most days are not extreme by definition, which means that even if this policy was effective, it would only target a small proportion of days that are leading to a specific impact on terms of population health. We just show that thinking in terms of just extremes for air pollution is not a good idea. Because even if it was effective, here this is like a double burden because it's not effective. And on top of that, it's not very strategic because it only targets one small proportion of it. Because the problem, the reason for which it's like we have that, it's really because for other type of extremes, like extreme heat, this is not the same because most days actually, like for example, between 5 degrees Celsius and 25, 28 degrees Celsius, this is fine. We don't need anything. And this is most of the days are like that. And then you have some extreme days, and that you need to do something. So for temperature, it makes sense. For other like extreme events, for example, I was checking today, there is a like air pollution warning system in the south of France right now because of dust storms coming from the Sahara. So that's relevant because that is rare and quite exceptional. Mm-hmm.
I have a related question to like the extreme versus chronic, I guess. So the number you mentioned earlier, like the 7 million that die of air pollution, is it like it's chronic?
Yeah, it's chronic, like for this estimation. So it's an underestimation because we don't take into consideration like the acute death. Yeah. Okay, but this is just like to think critically about how these policies are designed. And here this is it used to be, because now it's changing, but it used to be not optimal. Okay. I think I should stop so we have time for discussion. But just to wrap up, this is just another study we did in Paris. So it's very small, sorry, but you have it on your slides. It's just like in Paris. So since 2008, there was this air quality program, and it has been revisited, updated in 2012. And what we showed in the study, we evaluated, using a different identification strategy, but we evaluated the effectiveness of this program on mortality in Paris, and actually we found that it works. And actually, if I remember, I think it was, yeah, it's not there, but we found like something like 150 deaths attributable to air pollution were saved, prevented, because of this policy in Paris. Which again, is not optimal because it's only a few days a year in which we have this extreme, but still, it's better than nothing. But ideally, doing what is happening in Paris, this early warning system coupled with long-term strategy is really where we need to go. And this is what Paris is doing. There are a lot of things to criticize about the low emission zone, but one of the good things is that it's actually can have a substantial effect, and it has an effect every day of the year, so all the time. So that leads to substantial benefits. So a good solution is really to combine this short-term extreme event with like more long-term kind of day-to-day intervention. This is really the solution to try to address air pollution problems more generally. And the low emission zone is, so this is just an example about some evaluation we did about the low emission zone in Paris. And actually we showed that from the first phase of the low emission zone after 2018, we show like quite a reduction in NO2 and PM2.5 because of this low emission zone. And this is associated with substantial health benefits. Because even if it's small changes, this is small changes every day. So that's, at the end of the day, a huge contribution to reduce like the burden attributable to air pollution. Okay? I will stop there because I didn't have time to talk about wildfire, but it will be for an next time. So at least we have like something like 35 minutes or so to exchange, to discuss. Okay, so again, just to wrap up, that was just a way to just give you like a snapshot of what we do in my field and how we can think about climate change as not only a public health issue, but environmental justice issue, and how we can think about that. So yeah, I hope it was informative. Okay, so thank you so much, and let's chat. Okay, thank you. So how do we do it?
No, we'll give the mic.
So who wants to start?
Maybe it's exactly on the slide that you're presenting right now. So during your presentation. Hello. So during your presentation, you were mentioning that the AQI 2.5 of a car pollutant is different from the AQI 2.5 of a wildfire. But maybe quickly, like in a 2 or 3 sentence, if you could tell me how it is different. Is it because of the chemicals that is being exposed from the pollutant is different in wildfire than that of air pollutant, the car pollutant?
No, but that's actually very important because, again, anything that will have an incomplete combustion, like heating, traffic, wildfires, when it's going to generate PM. This is like chemically speaking, this is happening. But then the PM is just like the size of the composition in terms of chemical speciation. What is burning is going to drive what is going to be within the aerosol. So for example, if you have some just like just I don't know, like a very old car that is burning a lot of oil, like whatever, there will be a lot of specific chemicals in a PM as compared to a wildfire. So what is the difference between a traffic, like a traffic-based emission of PM 2.5 and wildfire? So traffic is going to just like generate PM, but are relatively low temperatures. The temperatures that are reached to create this PM in a car are not going to be the same as what you can reach in a wildfire. So the temperature is going to lead to like what we call oxidative potential. So the higher the temperature that is going to generate these particles, the higher oxidative potential. The oxidative potential is to which extent a specific chemical, a specific PM is going to be reactive. And so when it gets into the lung, it's going to be even more destructive because it will be super reactive because it has been generated at very high temperature. That's the first mechanism. The second thing is, depending on where the wildfire is taking place, it could be on soil with a lot of heavy metals, you know, and there is like documentation about how the heavy metals like arsenic, chromium can be just transported into the aerosols and can go very, very far away, and that could lead to more severe impacts. And the third component is really the bio aerosols, because in this kind of very, very small particles, it's not only about chemistry, it's also about biology. Fungi, bacteria, viruses are very, very comfortable being transported in these particles. And now we have evidence about how fungi, when there is a wildfire in a given place, and fungi are going to be transported to this PM, and they could be transported like over like hundreds of miles away from it, and that would be viable, so still very toxic and impactful. So that's really like the composition matters. So in terms of chemical speciation, oxidative potential, and in terms of just the biological composite bioaerosols setting. So that's very important. And one of the reasons for which wildfire smoke PM 2.5 is way more toxic is because of what I just described. And this is up to 10 times more toxic. There is so much evidence right now about that. So, but thank you for your question. The mic.
Yeah, I was wondering if there are any studies on the health impacts of geoengineering in terms of, I don't know, like I know there are like some plans, for example, to like use sulfur-based materials and so on, and I mean there are many drawbacks in terms of how like the local climate will be influenced and so on, but is there also evidence on air pollution, like how this would change and so on with geoengineering?
To be honest, is it related to something you've been exposed to or something?
No, I mean like.
Sorry.
Yeah, I mean like just to explain, like for example, there's like the idea to spread sulfur into the atmosphere and so on. I mean, there's many reasons why we shouldn't do it, because like there's high potential that, for example, I don't know. So yeah, to induce rain, but also to kind of simulate the albedo effect that is now also getting reduced because we have less and less pollution, right? But to like simulate this albedo effect, or kind of to simulate actually volcanic eruption and delay the warming of the planet. So yeah, because those are particles, right? I was wondering if they have any influence.
I am not aware of any health epidemiological study about that specifically, but maybe I will check just for my curiosity, but I don't think so. But it's true, but it's not an amazing idea to try to that, but it's happening a lot actually in some countries.
Yeah, my question comes like a little from a background. I lived in Hamburg for 10 years, and I lived in like one of the areas that is mostly working class, has like 50% migration background, and the average death ratio is 10 years younger than the average in the life expectancy in the whole city, like drastic difference. And the air pollution is actually, after testing, it was found out that the air pollution is over the limits of European standards. And then they realized, why didn't we realize this earlier? It's because the testing station was not even in that area, but a bit more far away, in like a small green strip between other trees and so on, and there's no other nature. It's like directly next to the industry. So my question to like the warning is, do we actually have the infrastructure even to test like air pollution, to report it early enough and so on? So I feel like, I don't know, maybe the study even has like the problem that we can't properly estimate when air is bad and so on, and especially early warning. I mean, we can't even test if we are over the limits.
Thank you. No, that's a very good point. And across the context, in Toronto, actually, there is a very good network of stations. So it's kind of everywhere, but it's true, this is a big problem because you can't, if in order to name a problem, you need to measure it. It needs to just like have the data. And of course, where the stations are going to be located are going to not be random. And that could be a problem because if you just don't measure a problem, you just in this neighborhood, it's not going to be an issue. But that changed, and it's changing a lot right now because we are using stations for many, many applications, but right now we have so much resources with satellites. And now, for example, since 2018, for NO2, there is like a satellite product that is called Tropomi. It's everywhere, every day we can have the value. So we just don't have to rely that much on stations in places in which the network of stations is not that high. There are places like in Europe, it's not that bad, but still in Paris, I think there's something like, I don't know, just like a random number, don't quote me on that, but I think it's 15 stations. And there will be a few stations in different neighborhoods, a few stations in like nearby the peripheric, and stuff like that, but there will be a lot of places in which there is nothing. So we need to do like land use regression modeling or different types of technique, but now we have the satellites with a very good resolution and everywhere. So that is changing the game a little bit. But it's true, this is like, you need to measure it to know it. And for the forecast for warning system, usually this is also based on some kind of chemical transport models. So because we need to forecast to predict what's going to happen in the next few days, so this is based on chemical transport models that are based on, like trained on different stations and data and everything. So that's kind of in France, the one that is used, or in Europe actually, it's called Chimère. This is a chemical transport model that is used to just like forecast levels of air pollution. But you need to train and optimize this model with stations. So if you don't have stations everywhere, this model is going to perform very well in specific settings and not in others. So that's a big problem. But now it's not as like 10 or 15 years ago because of the satellites. So this is like in Germany, but also in Sub-Saharan Africa or in Morocco, etc. Now there is no excuse. We don't have to rely on stations to have data. There was this very famous example. I don't know if you heard about that. It's a nice story about in China about how they actually didn't display the data, but they had to, after the U.S. embassy put a station on a roof. And they showed that the levels that were like reported were way higher than what the Chinese government was reporting. And after that, that was a game changer in terms of monitoring and surveillance for air quality in China. But that was just like an anecdote. But so knowing matters. But now with the satellite, it's a different context. So yeah. But thank you for the question.
Thank you. Do you have any case study or more details on international cooperation with regards to air pollution problems? Because the reason I'm asking is because we have seen the local solutions, for example, like the Paris case that you just gave us. But for example, like I'm from Thailand, and sometimes our neighbors they are agricultural, yes, and agricultural countries, and time to time seasonal. When the harvest season comes, they do a slash and burn practice. So we have a lot of smoke in the area, and time to time air pollution become bad. So we address Thailand, but the smoke also come from from Laos and Cambodia. Yes, but it is in peripheral, yes. Yes. But so I was thinking whether like there's a case where the international cooperation is successful in mitigating the air pollution problem, because all that we do is, okay, we ask for cooperation from another country, but sometimes they comply, sometimes they do not comply. They don't have the, how do I say, the force to put into action the policy. Thank you.
Thank you. So I can think of a few examples. There are some international protocols that are about just like pollution more generally, and pollution that may or may not have health issues. The most famous good story, like positive story, is about the Montreal Protocol. In which year was it? Like early 90s or something like that. I don't know. Do you know? I don't know. Like the, for the like just to for the like ozone, like the ozone hole, basically. And that was an international protocol to agree on just like regulating specific type of pollutants. But another example about wildfire is where I spent like some of my life in San Diego. You know, San Diego and Tijuana are basically the same city with a border in the middle. And of course, when there will be a fire in Baja California or a fire in California, it's not going to stop at the border. It's going to. So there is like a kind of cross-border coordinating effort and department that is mutualizing efforts for this type of issue, specifically on air pollution. So that's an example. But last year or 2 years ago now, in June 2023, there was this huge major wildfire in Canada. There was a study that has been published, I think, 2 or 3 months ago, showing how the smoke from this like wildfire taking place in Canada actually went to Europe and had impact in Europe. So there is like no reason to think that there is a border that will prevent. So there is like a lot of like ongoing effort to coordinate between Mexico and the US and Canada. In Europe, I don't know. I'm not aware. But Europe is also like air pollution is regulated at the European level. I mean, the guidelines at European, and each year France is paying a lot of fines because they don't meet them, they don't respect them. But yeah.
Actually, this kind of situation is dealt with like case by case basis.
To my knowledge, for the type of issues, yes. Yeah. Yeah. Any other question, comment, or anything?
One second, your computer and display this. No, can I put this? Yes, this way. No, I want to put this.
To zoom?
Oh yes, no, this one I want to put it. Where is it? Here.
Ah, on this note.
Yes. Here is it. Okay. Now, I just wanted to ask you about, I mean, I'm afraid about pollution, but this is about heat humidity that you mentioned. And when we look at the IPCC report, and when we look at what shall happen, we are probably here by 2000. I mean, part of the world is not anymore habitable because here you have the number of days. This is the number, the color is the days per year where combined temperature and humidity condition pose a risk of mortality. Okay, and if you look here, also Southeast Asia, I'm sorry for some of you, and part of Latin America is unhabitable for more than 200 days per year. So, no, it's in a case of plus 2.4 to 4.23 degrees Celsius. So how can we deal with this?
Okay, so so just like to summarize, so this is just like a work from the last IPCC report, which is based from actually works from some colleagues that actually did this kind of indexes about this kind of human heat tolerance, and just like showing according to different kind of mitigation scenarios, more or less optimistic, but also more or less realistic, according to different scenarios, and that are expressed in terms of change in temperature, the number of days, which is like what the scale you can see on the top of this kind of 3 maps, in which like this threshold of human heat tolerance is going to be exceeded, is going to be just like very like most of the days during the year. So this is like, I think, important, but like first like it just highlights just like the need to mitigate, just to right now do some actions. So by the end of the century, we will not see that. But this is a very slow machine. So that's why whatever we do now, we will see like this like the beginning of this pattern, even if we're doing a lot of efforts, which is not the trend anyway. But even if we do, we need to adapt. Because it's not because outside it's going to be like very hot and humid that we just like have to move elsewhere or anything. We just need to adapt, and there are many things that we need to do to adapt in terms of an example. Like if we look at Southeast Asia, for example, it is like just an example. There are so many, but rice farming, for example, you can't just like if your main source of income is to just like be a farmer, and so you have to work outside, and you can't choose the season, and you really have to be outside. So, and of course, it's not, some people are more resilient than others. For example, again, it's a huge simplification, but if you have to prioritize who you need to protect during like these very hard days in terms of rice farmers, maybe pregnant women would be a priority, for example. Just like, that's like a very rational decision, but just, it's more complex than that, but that would be an example. You just can't just like say, oh, you're just not going to work. You need to adapt and be creative, and there is a lot of innovation that is needed there. One of the potential innovation, I don't know if some of you have worked on that, is like the idea of these conditional cash transfers. So the idea is that, okay, tomorrow there will be like a very hot day with like a lot of humidity. You're not going to work. Instead, we give you the amount of money that you will have obtained by working, but with a condition. You're going to train and get alternative skills, so you're going to diversify your sources of income. That's a projection, and that will happen. But the thing is that by the end of the century, I guess we'll have to adapt. And that will, in this context, if that happens, because this is like exaggerated at the end of that, but this is like, the situation is already bad. But just having just like 75% of the days that are just like intolerable in terms of heat and humidity, you will have to change everything, including the food system and everything. So that will be, but right now we need to adapt and just like get used to that. And also this is, but that takes a lot of, this is getting, because this is like a product, global product in terms of course, this is also, but it's a simplification that is absolutely needed when you want to do this global study. But there is like, it's like this, what they call this kind of heat health tolerance days varies a lot about who is going to be exposed, and there is vary a lot locally according to the context and everything. So this is bad, but I think this is also like some kind of part of the advocacy effort, just to illustrate how urgent we need to do something about it. But we need to mitigate, but in the meantime, we need to adapt.
How many people really realize that type of, or saw this type of map?
No.
So if we want to advocate, and only 2 people here knows about that, and
It's still some work.
Almost no politicians know about that.
Yeah, for heat, actually, heat is to me the less, like, this is by far, if I had to rank the biggest climate change issue for health, heat is beating everything. Like all of the vector-borne diseases, all of the like natural disaster, by far, heat is the biggest killer in the world. But this is so sneaky, so silent, and also kills people that are, this is like there is this sentence about extreme heat is a silent and invisible problem, killing silent and invisible people. And this is really the problem. But for example, in the US, this is like 12 to 20,000 people dying because of heat every year. In France, it depends on the year, but it's like 10,000. This is huge, and this is so easy to prevent. That still happen. So sorry, there was a question I think before.
Can you give a bit more context to this graphics? Because like, I mean, I've looked at it several times before, and how I understand, like, I mean, or how I interpret this, like, if you, the violet areas, there in my interpretation is life is impossible, and I think it's not like when you say adaptation, I'm very like I'm not sure, like maybe then I misunderstood the graphic, but for me, if you have 200 days where you basically just if you are like half an hour outside, you can die. I think then society breaks down, right? And I mean, of course, you can, like, I don't know, offer people money that they retrain, but at the end of the day, right, an economy is about real goods, and if the real goods can no longer be produced and so on, if infrastructure cannot be built and so on, then I think, or like, my interpretation is then so society breaks down, but maybe I interpret this wrong.
So this concept of like human heat tolerance is just like, it's not you go outside and you die. It's just that at this condition, if you just engage in like normal activity, especially for some like very susceptible individuals, that could be like very detrimental. So that's a big problem. I'm not trying to undermine that. It's just that this is a little bit on the pessimistic side of things, because this is like just like 300 days a year in which it's intolerable. Just like, okay, whatever. This is a little bit like discouraging when you think about it. But this is also, this metric is one metric that I think can be useful to illustrate how bad situation, and also to illustrate the problem of humidity. Because the reason for which there is so much spatial variability is really because of the humidity. The humidity is a big problem here. And there are solutions to actually reduce a little bit the just level of humidity, etc. But if we get to the situation that is highlighted on a third map on the right that we can see here, I don't want to be in this world. Most of us won't be there anymore. But this is this is really like a bad situation. But my point is just to kind of take some kind of distance from what it's supposed to represent, because there will be this temperature. And now if you look at, for example, what is happening in, I don't know if you go to Vietnam in the summer, so this is already reaching these levels most of the summer, so you can know, and of course the economy is going to be impacted, the food system are going to be impacted, so there will be like drastic, huge changes. But my point was just, we need to adapt right now. This is already happening in some places, but at this point of impact, this is like a little bit discouraging. But this is that by the end of the century, this is important to mitigate, to avoid having this situation to deal with. But whatever we do now, we'll have to deal with an increase anyway. So that's why we need to adapt. That's kind of. Just like.
But because I know like with a lot of indicators, adaptation sometimes no longer possible. Like with flooding and so on, like is adaptation in those violet zones, is it even like technically feasible? Can we adapt? Can humans adapt to such a situation?
Actually, this is coming. So this is from like a replication, but this index has been published. Like there was a global study by some colleague from the UCLA and other places, and they did that. Also, there was a lot of issues in a Arabic peninsula, where they're already like most of the time, especially in a context of the Hajj, like the religious ceremony. This is a big issue, and there was a lot of kind of counter advocacy or kind of sneaky advocacy, let's say. But anyway, this is like, to me, this is important just to highlight heat. If you have to choose an enemy, this is it. This is a big issue. Mm-hmm.
There was a question here before.
Sorry. Priority.
Thank you. You mentioned pollution and how it affects all of this, and then you mentioned also adaptation strategies. And when you mention adaptation strategies, you talk at the level of cities, for example, the level of what Paris can do, metro and stuff. And there have been other examples that are more or less successful at regulating pollution or heat temperatures within very specific places like cities. And I wonder if that would be like really useful in a context like this we're saying that is a global situation. It is that useful to do this localized, or is it diluted by the general effects of, I don't know, a big polluting country like India, China, etc.?
Thank you. No, it's all of them. Actually, it's very important to have this kind of multi-level of intervention, because you can't just rely on this global kind of protocols or intervention. At the end of the day, especially for public health, I'm not talking about other fields, but in public health, what is going to make a big difference is what's going to happen locally at the community level. But of course, what is going to happen at the community level is going to be driven by regulation in a state, regulation in a country, etc., and international regulation. So this is multi-level, but for public health, this is really like locally speaking that is happening. For extreme heat, there is a lot of evidence about the effectiveness of heat action plans. And one of the things that makes a big difference besides this cooling center and everything, this is really about this kind of listings, neighborhood by neighborhood, of who is particularly vulnerable, susceptible to extreme heat, and when there is a heat wave, whatever the definition of heat wave that is activated, triggered in a heat warning system that is in place, there will be a trained professional, typically nurses, that will go through this list, call people, remind them dedicated advices about what type of medication to take or to do not take, like how much to drink, and just remind them specific function. And if they have like anything, they will visit them, and that's free, and bring them to a cooling center or anything. There is a lot of community-based actions. This is what saves lives. This is this type of intervention that makes a big difference, and that has to be local. France is a counterexample. France, and that can be explained by many reasons, but the way we approach extreme heat and heat prevention is very like kind of top down. There is a national plan for like heat prevention. It's very like top down, and there are like some kind of very wide definitions. And then that started in 2004. Because in 2003, you probably did not miss that there was a huge heat wave in Europe, and there were like something like 23,000 deaths in entire Europe, and out of these 23,000 deaths, 15,000 deaths took place in France, and a lot took place in Paris. So in 2004, France started this national heat action plan, but this is very top down. But in the previous years, because it became such a big issue everywhere, that municipalities noticing that it may not make a difference, just to let people know that there was this kind of national intervention. There were a lot of municipalities that started to do some actions, and there's a lot of things going on. What makes our life or work very difficult to evaluate, to document that, is that there is no systematic documentation. So we really need to spend a lot of time on the phone to understand what they're doing, but a lot of things are happening. In Paris, you go to Montreuil, you go to a lot of small cities or neighborhoods, so much is going on where there is a heat wave. But of course that is going to be influenced by like multi-layer policies, but for public health, the local matters a lot. So.
I'm still having a bit hard time interpreting the air pollution because you showed the graph of the temperature, I think it was, or of climate change, how this developed. To put the current air pollution into perspective, is this basically a similar trend that it's going up like crazy? Are 7 million deaths? This is a very high number. I mean, of course, it sounds like very tragic, but I mean, like, just to put it in perspective, also to past periods, what's the trend basically of air pollution?
So, the trend is like towards an increase, but not necessarily. There is, like in many jurisdictions, there is a decrease in air pollution because of some regulation and everything. Not everywhere. I didn't have time to show you that, but I had a figure to show that how in California, for example, if you look at air pollution levels like since the 90s, there was a big reduction because a lot of policies have been implemented in terms of to try to reduce emission from traffic and everything. But all of these efforts have been erased by the contribution of wildfire smoke. There is so much wildfire smoke now. Now, air pollution in California is a wildfire smoke problem, and that's basically erased like 3 decades of efforts in just like 5-6 years. So there are like this increase, and also so it's not just about the change in exposure that matters. There is also a change in the number of people being exposed, and also a change in the composition of the population. There is more and more chronic diseases. People are living longer, so there is just more people that can be affected by air pollution. So that also leads to this increase in the total burden attributable to air pollution. But but for some pollutants there is a decrease. But PM2.5 in Europe, you see a decrease in the last 2 decades. But this is being reversed because of some new sources of emission, and wildfire is a big one. Dust storms, like what happened today, I'm pretty sure we have some in Paris. We know like this kind of dust storms coming from the Saharan belt. There is like, it travels so far away. It travels to the Amazon. Actually, the Amazon will not exist, will not be there without this kind of specific process. But we have it in France. And there is an alert in the south of France, but I'm pretty sure we have some PM because of the dust storm happening right now. I need to check my phone.
Compared to pre-industrialization, it's still probably a lot higher, right? That was
of course, because what is leading to, as I said, like most of the pollution is generated by incomplete combustion. So of course you had some fires and like heating that generate pollution, but of course like most of the pollution is driven by just like industrial activities and traffic. So yeah.
Thank you very much.
Shall we go? Okay. Thank you.